Welcome, everyone. My name is Luz Chapa, and I'm a clinical consultant with RMTAC, and we're so happy to have you here today with us. And today, we welcome you to the Crisis Intervention and Safety Training when working with refugees and migrants, presented to you by the Refugee and Migrant Technical Assistance Center for Behavioral Health, which is made possible by funding through the Substance Abuse and Mental Health Services Administration. Our team is proud and eager to present to you all on navigating through crisis intervention and safety principles that will empower staff to effective change agents in the organization. And of course, as we move into the contents of this presentation, please be aware that we may cover heavy topics and material. And we encourage you to be mindful of what comes up for you and engage or participate with the content at your own comfort level. Great, so let's go ahead and move on to the agenda. These are the areas that will be addressed during the presentation today. We will begin by defining what a mental health crisis is, including its signs. Then we will look into potential risk factors and effective strategies to utilize when de-escalating a crisis. We will then finalize the presentation with basic safety tips to practice along with implementing healthy boundaries and creating a culture of care and compliance for staff members and their clients. And again, we are very excited to be here. My name is Luz, and with me today are my colleagues, lead clinical consultant, Dr. Mutsum Jaro, and clinical consultant, Dr. Z. And today we will be presenting on crisis intervention and safety training when working with refugees and migrants. By the end of today's presentation, we hope you will have a working understanding of identifying the key components of a crisis. We will then identify effective strategies to utilize when de-escalating a situation or crisis, which includes basic safety principles and creating safety plans. Okay, so let's move on to our feature presentation. Now, what is a mental health crisis? A mental health crisis can be devastating for the individual, family, and those involved. The National Alliance on Mental Illness defines a mental health crisis as any situation in which a person's behavior puts them at risk of hurting themselves or others. And it's important to note that anyone can experience a mental health crisis, and they can occur in people who do not have any diagnosis. Other similar terms used are known as mental health emergency, mental breakdown, or nervous breakdown. However, the important thing here to distinguish is whether or not a person's behavior is causing them to be a danger to themselves or others. And if so, immediate help needs to be provided. One way to assist you in providing the immediate care is to recognize the signs. A mental health crisis can occur all of a sudden, or it can develop over time. Every crisis may present itself differently. For instance, an individual experiencing a crisis may believe that they are not able to control their emotions, and that feeling may be so overwhelming that finding ways to cope or handle these feelings is far too difficult for them to manage. And a crisis can involve experiencing difficult pain or danger. The client will begin to worry and become less confident, or they may find themselves in a stage of instability. Usually a crisis is an unplanned event, situation, or when you least expect it. And from my experience in having to assist in several mental health crises, some of the things that I wish I knew back then and that we really need to consider is it's important that staff have proper history and background information about the client without breaching confidentiality and protecting the client's integrity without disclosing personal identifying information. It's also important to follow your organization steps and strategies. What is your organization's protocols and procedures when it comes to crisis interventions? What types of interventions are you able to handle and conduct? And what are the areas that are restricted when conducting a crisis intervention? Also, keep in mind that if you work with children, there may be certain interventions that you may not be able to conduct with children. But before we go over what a crisis intervention is, we must note that for a crisis to exist, the individual must first perceive that they are not able to cope with the situation they are experiencing. When performing crisis intervention with refugees and migrants, it's important to prioritize active listening, validation in their experiences, and provide immediate safety and connecting them with the cultural appropriate support services. A crisis for refugees and migrants can be due to a variety of reasons, including the loss of loved ones or their homes, displacement, serious illness, natural disasters, financial hardship, traumatic events, sexual assault or abuse, substance abuse, violent crimes, mental health issues, and many other reasons. These are just a few, but it can also include situations where a client feels overwhelmed and unable to cope with their current stressors, using their current coping skills or mechanisms. And essentially, any situation that is perceived as a sudden loss of ability to effectively manage emotions can trigger a crisis and may require intervention. Now, what is a crisis intervention? It is a process of assisting the individual in returning to their normal functioning level. This can be a process that involves the individual venting or expressing their emotions. Crisis intervention should be used when the staff member has thoroughly assessed that the individual is exhibiting irrational or risky behavior. And as I mentioned before, a crisis may present itself differently. However, a crisis will be perceived as dangerous to the individual's physical, psychological, and/or emotional well-being. And some components to consider for crisis intervention when working with refugees and migrants is utilizing a non-judgmental approach. We can begin to stabilize the situation here. Remember that the goal is to reduce the intensity level of distress, so it's important that we avoid assumptions and actively listen without interrupting to build that trust. One way to do this is by using language that conveys understanding and compassion to the situation. Here, we begin on building that rapport with the client. And if possible, we can utilize interpreters or culturally competent staff to facilitate that communication. Next, we can assist to identify what were the precipitating factors that led to the event. And here we are assessing for potential risks and triggers. However, we have to be mindful of triggering questions or topics related to their traumatic experiences. We want to avoid the re-traumatization. Now we begin to work with the client through problem solving, where we will need to collaborate to develop practical coping strategies to address the immediate crisis and develop safety planning strategies to avoid further events to assist the client in managing potential dangers and triggers. And last, we look at the referral process for further support. This is where we identify culturally appropriate resources. Now, let's look at the mental health within the resettlement process. Refugees have an increased risk of mental health conditions during the resettlement stage as a consequence of the significant personal disruption and experiences of either torture, trauma, and/or the loss of their loved ones and their home countries. Refugees and migrants show greater levels of overall psychological disturbance than their US-born counterparts. External challenges during the resettlement process also places stress on the mental health of refugees and migrants by contributing to factors such as a culture of stress, communication barriers, social isolation, and discrimination. Refugees and migrants may face several stressors, and for the purpose of this topic, we will focus on the resettlement stress. Resettlement stress can lead to a wide range of mental health effects in refugees and migrants, including high rates of depression, anxiety, post-traumatic stress disorder, adjustment disorder, and substance abuse. Many of the mental health issues faced by refugees and migrants are frequently caused by the dramatic events they endure while being forced to leave their home, combined with the difficulties of adjusting to a new culture. Not being able to communicate effectively in the new language creates challenges in daily life, which can lead to feelings of loneliness or isolation. Other stressors that refugees may experience include financial stressors. Often refugees face significant financial stress when they arrive to the US due to the combination of factors, including lack of job skills. The skills refugees and migrants acquired in their home countries may not be recognized or valued in the US job market, forcing them to obtain the required additional training or education to be able to gain employment in the United States. Cultural differences hinder their ability to quickly integrate into the workforce, leaving them struggling to cover the basic needs like housing and food, even with the minimal support or assistance they may receive. And overall, this highlights the complex and many challenges that refugees and migrants face, often leading to mental health concerns due to the combined effects of past trauma and the stresses of adapting to a new environment. Clinicians and therapists have begun shifting their focus away from solely focusing on refugees and migrants' traumatic experiences to having a broader understanding of the challenges refugees and migrants face during the resettlement stage, while actively promoting resilience and fostering strength among refugees and migrants, because research and practice have demonstrated that simply addressing past trauma is not enough to address the complex realities of navigating a new life in a new country. Incorporating a focus on resettlement challenges and fostering community support, clinicians can better equip refugees and migrants to overcome obstacles and build a new life with stability and purpose. Next, we will briefly discuss the importance of knowing how to distinguish a crisis in youth and adults. When working with children and adults, it's important to understand the differences in presentation between both during a crisis. A youth's coping skills, vulnerabilities, and need for support can vary significantly. This may require tailored approaches to ensure the safety and well-being of both. Some key components to consider about the differences between youth and adults in a crisis are their developmental stage. Children and adolescents are still developing their coping mechanisms. We need to also consider the individual differences for both. Remember that not one crisis will be the same. And the access to support due to age. Youth often rely on adult caregivers, which can create a strain in the relationship, especially during a crisis. Depending on the organization, agency, and program and situation, further services may not be provided to youth in a timely manner due to the needing of parental or caregiver consent. Therefore, it's important to have a tailored support system and knowing the needs of youth and adults to help identify a crisis and provide early intervention to prevent further issues later. And now I will pass it on to my colleague, Dr. Z, who will be discussing the risk factors, recognizing the signs, and effective strategies when dealing with the crisis. Thank you.
Thank you, Luz. And we're going to continue on with our presentation with an overview of the risk factors for a mental health crisis. So all of us are mental health professionals. We have mental health training. Use your imagination. You can pretty much point out anything that can be a risk factor for a mental health crisis. Any kind of aberration from what we would conceive to be a normal life. So physical and sexual abuse, economic stress, substance abuse, history of mental illness, or depression, anxiety. But we're talking about here with specificity to refugees and migrants. So the risk factors that are most pertinent for those individuals include the stress of the journey, along with all the other things we talked about, stress of the journey, and in the inherent abuses that may be experienced during the journey, emotional, physical, maybe sexual. Unfortunately, this is our reality today. The uncertainty of reaching the destination and the potential for being in a bureaucratic limbo as their case goes through the legal channels, or the dangers of the crossing. This is also potentially items that can increase the anger, the agitation, the irritability, which can build for a potential mental health crisis. The risks to their loved ones, either back at home or with them on the journey as well. Discrimination, the fear of, the risk of, or the experience of discrimination is another risk factor for enabling the possibility for a mental health crisis. Also, the current political climate is definitely not helping the emotional stability of people who are going through this unbelievably difficult time. So I think that these can be all chalked up to different risk factors for the mental health crisis. So in terms of recognizing signs for the mental health crisis in refugees and migrants, it is critical to identify and correlate and mitigate the crises. Signs include behavioral, emotional, cognitive, physical signs. Risk of harms to oneself or others is always an important sign that is critical to prevent. Signs can be behavioral, they can be emotional, they can be cognitive, they can be physical, or they can have risk of harm, self-harm, suicidal thinking or thoughts, thoughts of harming oneself, in terms of the anguish to a mental health crisis. A key factor is to know that person a little bit more than just having met them. It's important to get collateral information. If it's a child, learning what they were like before from parents or from other family members, caregivers would be important. Or if you've been working with them in a facility, learning about them in terms of knowing about them for how long they've been with you, that could also be in terms of improving your ability to anticipate, mitigate, and corral a mental health crisis. So recognizing these signs, inability, problems with behaviors, difficulty performing tasks, emotional signs of very intense anxiety or intensive feelings of worried, cognitive tasks of confusion, or physical tasks of changes in sleep or appetite, all can be utilized in terms of recognizing the signs of a potential budding mental health crisis. What are effective strategies that we can utilize to assess the risk? Well, utilize various assessment methods and tools to assess risk for the mental health crisis. What we want to do is we want to initiate initial contact and rapport building. We want to establish trust with our potential clients, with our patients. You need to do these things like such as risk assessment, mental health status examinations, meaning you're going to be working with these people. As mental health professionals, we do mental health status examinations almost daily, all the time. So when we see a little change in a person's mood or affect, we can kind of put our ears up and make and kind of paying more attention, seeing what exactly is causing maybe the change or the difference in the mood or the affect. We can assess utilizing our skills, our inherent skills, or our empathy, to make sure that we can maybe prevent a mental health crisis. But this is all important parts of assessing for the risk of developing those skills to prevent a mental health crisis. Functional assessments, seeing how people work in their daily environment, even if they're in a facility, how they just mitigate them, how they just work around what they do in their trouble in their environment. It's important to have the social environments where they see how people are interacting with other people. Making sure that you have that initial contact and that in the rapport building is important. So on the right of the screen there, we have several tools that can be utilized to assess for risk, and they've all been standardized, and they're all excellent resources for assessment of risk. Next, what we're going to do is actually talk about what happens in a escalation. Now, what I'd like for you to do in the next slide, with the next slide here, what I want you to do is I want you to put in the chat what you guys think of when it comes to mind. What comes to mind when you think of crisis intervention? What techniques? What particular methods or patterns or plans would you guys utilize when you talk about when we talk about something called crisis intervention? What comes to mind? Please drop it in the chat. Or SBIRT. Rapid response is a good one. That's a good one. Something that's more quickly. Yeah, speed is definitely of the essence in terms of dealing with an escalation. Providing space for the client to express their feelings, referring to a health professional crisis time. Excellent, excellent. Keeping the individual safe for now. That's right, exactly. Safety is always primary number one. Safety is always the main goal, because we want to prevent these people from hurting themselves or hurting anybody else. Thank you for your suggestions. Appreciate it. Let's talk about de-escalating a mental health crisis. So when we talk about de-escalating a mental health crisis, what I'm going to do is I'm going to go back and utilize my own personal experience, because because I am a psychiatrist. I've been in charge of mental health units and had to de-escalate many a mental health crisis in the past, from all ages: adults, veterans, children, elderly. So what I'm going to do is I'm going to use my own experiences as a as a kind of a venue for de-escalating mental health crises. So one of the skills that people have mentioned in the chat, and then also in terms of utilizing my own skills, is you use your body for a medium for expressing calm. So think about it this way, right? When you're in your office and you're at your job and you're working with your patients, or you hear the bell or the alarm saying that, oh, there's a crisis on the unit or in a different part of the hospital, you have to and you have to get over there, and then you go over there and you find out, oh, it's your patient, and you have to be the one that's going to be calming the patient down, calming them down, bringing them down, trying to de-escalate that crisis. You want to present a sense of calm to them. You want to be like, listen, you want to continue to inspire them that everything is going to be all right. Right then and there is not necessarily the time to decide what caused the mental health crisis, but the idea is to bring them down from what triggered them. So being very kind of, forward thinking, being very, comforting with them is a big part of expressing that calm. Lowering your tone of voice and using a palm up gesture, relaxing your shoulders, angling your body slightly and creating a spatial distance, relaxing the face, and even smiling. If they don't take it negatively, try to smile, try to impart that you are on their side and trying to help them get through this difficult portion of whatever is upsetting them. I know that I've had to do that several times when working with mental health crisis patients of all ages. It's important to listen to what they're saying. Make sure that you listen carefully to what they say. What is it that they are expressing to you? The words that they use are going to be a clue as to what is exactly is causing them to be so upset. Now, if it's just jumbled, irritable words that just don't make any sense, then you have to do a better job of bringing them down from that kind of irritability, from the kind of hyperactive sense that they are in a sense of crisis. They may be in a fight or flight response. I mean, I'll tell you, it's not uncommon for them to be so upset and so irritated that they cannot bring themselves down to speak normally. And this can also be applied to refugees and migrants too, because of all the terrible, unbelievable experiences that they've experienced when they were in their journeys or in the facilities from when they were being incarcerated essentially in a new country, or especially in the South here. So it's important to hear what they're saying. Words have meanings, and the primacy of words even more. So no matter how they're illogical or emotional, listen and acknowledge that you're receiving the message. Make sure that they know that they are being heard. Validation is hugely important in this sort of situation. Validation is invaluable. It helps to really get through to them, through the emotions that they are having, that they are being heard. Because that's a lot of times they just want to be heard. These people just want to be heard because of what they're going through is so unbelievably difficult that it is so painful for them, and they don't feel like they're getting any kind of control. They've lost control in what the environment that they have. So the only way that they can make themselves be heard and make themselves be known is to have a crisis, because people weren't listening to them. So make sure that you hear what they're saying, validate their feelings, because even if you don't agree with them, the validation is not an agreement, it's recognition. Okay, all humans want to be recognized. People want to be recognized and validated. We don't want to be treated like toddlers. We want to be we want to be respected and validated, and that's a part of this um, process that can go a long way in terms of dealing with the crisis. I know that I've dealt with VA veterans, with veterans who have been, all they wanted was validation. They felt that they felt control taken out of their lives. So what you want to do is you want to make sure that they're being heard, and then you want to make sure that they're being listened to. So you repeat back what they're saying, summarizing what they're saying, and also improving and making sure that they understand that you understand what their questions are, what their issue is, with what's been happening. Using open-ended questions is hugely important. It shows a genuine interest in their problem, in their experience, in their perspective as to why they're putting themselves forth. Using open-ended questions also makes sure that they're not being boxed into a corner. Making sure that you're showing empathy. I'm so sorry to hear that. Is a big part of the empathy, the sympathy, and the keeping the open-endedness of it. Yeah, and validation. Even important is validation. And another thing is that don't be judgmental. Do not be judgmental to these people, because being judgmental is also another point which may be triggering to them. It is not your role to be judgmental. It is your role to be the advocate for them and to help them get what they need, because they feel that they're not being fulfilled. That's the big problem with the mental health crises, that they feel that there's something that's not being fulfilled and they need your help. But they've been so beaten down by the system that they don't know how to express them, because being quiet hasn't helped them. So being loud is not going to help them. So being energetic, but being respectful of them is going to help them more than you can possibly know. One thing that you need to realize is also is check yourself at the door. Really, it is check your ego. I remember several times where, this crises would mess up your plans for the day, which would naturally be irritating. But remember, these people are people, and you need to check your ego at the door, and you need to make sure that you understand and respect that these people have been going through unbelievable difficult traumas. Refugees, migrants, children of child abuse, sexual abuse, everything. Put yourself in their shoes, use your empathy to understand where they're coming from, and basically what we need to do is we need to improve, we need to achieve emotional equanimity between the two of us, between the provider and the patient. Basically, what we're going to do is we're going to stay calm. The main thing is we have to stay calm. Calm demeanors produce calm outcomes. Using clear and simple languages. Clear and simple language. Do not talk about speaking in abstracts. Do not attack people. Using clear and simple language. Keep it simple, and keep the language very kind of easily understandable. Active listening is a really important piece of this. We have to be continuously listening to what our person is saying, what our patient is saying, because they're going to tell you what is really going to drive, what is driving them towards this type of behavior. And when you listen and you hear what they're saying, then you can act upon it, and you can help to calm everybody down, and you can show empathy, validate their feelings, and be non-judgmental. Using non-threatening body language is important in nonverbal communication, because not all communication is verbal. Using non-threatening body language will keep their fight or flight response kind of toning it down. Open postures, avoiding sudden movements, and keeping a safe distance. Setting boundaries and limits are important as well too, but you've got to be respectful. You do not want to press up against a patient or a person, because that will irritate them, and that'll maybe kind of escalate the situation when your goal is to de-escalate the situation. Boundary, you also provide a boundary about what behaviors you're going to willing to accept. One time I remember I had to set a boundary with a patient by telling him to stop swearing at me, because he was a VA patient. He was yelling at me, he was swearing, he was not helping the situation. I set a firm boundary. I told him that I will not talk to him unless he stops swearing. And he stopped swearing, and we kept on the conversation and de-escalated the situation, and it came to a successful resolution without violence, which was the goal. Because obviously, in any psychiatric intervention, we want to reduce the risk of a physical confrontation, because that is used as the last resort. Offering choices and control. You want to make people think that feel people are being empowered and they're not being manhandled. Using distraction techniques and de-escalation phrases, understanding, keeping that kind of open-endedness and empathy as well too. Safety first is always the most important thing. So if you have to, at the very end, if you have to use physical altercations to keep people safe, then you do it. But you obviously work towards not getting to that point. Your goal is to prevent the kind of utilization of physical takedown methods. And then after you get the situation calmed down, you get people kind of relaxed, and the temperature's gone down. You use the follow-up, the professional follow-up, emergency services, crisis hotlines, or mobile crisis units, or you get them to be seen by providers, patients, or by providers or physicians in the clinic the next day. All these things can be utilized to really kind of de-escalate the mental health crises, and to bring about a safe and appropriate ending. Much appreciated. Thank you very much for that.
Wonderful. Thank you, Dr. Z. Now that we've reviewed the factors that contribute to crises and the strategies for de-escalation, we'll move on to exploring some additional safety principles. When thinking about safety in moments of crisis, it's important to be proactive and have a plan in place at all levels. So at the organizational level, it's crucial for leadership to proactively support staff by offering trainings like psychological first aid that can provide valuable tips and strategies for crisis prevention and intervention. Additionally, ensuring that effective policies and procedures for crisis intervention and staff safety are in place is crucial. Another key element is supportive supervision. So encouraging your supervisors to create safe spaces for staff to consult during a crisis and also debrief afterwards is really important. Supportive supervisors can also help to advocate for staff to have manageable caseloads to help prevent burnout, which in effect can impact crisis situations. Now, on an individual level, ensuring your own safety and well-being is crucial for effectively implementing the de-escalation strategies that were reviewed by Dr. Z. If you're already dealing with burnout and compassion fatigue, it can lead to mishandling crisis situations, which can in turn potentially escalate them. Therefore, it's essential to practice self-care both outside of work and at work. Another safety tip entails utilizing both formal and informal supports. So formal supports can be your supervisor, while informal supports can include your coworkers. If you have a client that's showing signs of distress before a meeting or a session, it's important to inform your team. This way they're aware and are ready to check in or nearby if needed. This kind of reminds me of when I worked in college counseling. We used to keep what we called safety buttons up at the front desk. So if we were going into a session with a client who was potentially in distress, we would have those on us. If during the session anything escalated, we're able to press those and it alerted the front desk staff, and either them or supervisors would step in to assist. So you may not have tools like that are available, but implementing strategies such as arranging your office to ensure that you have easy access to the door in case you need to step away quickly can increase your level of comfort and preparedness. On the client level, it's crucial to clearly and thoroughly review treatment and service expectations as early as their intake sessions, including the client's rights and responsibilities. So having a policy that outlines these expectations is essential, as it details how clients can be or how clients should be treated when they're receiving services, and emphasizes their obligation to treat service providers respectfully as well. This is essentially important for refugees and migrants who may not be familiar with the U.S. health system and the limits that may exist within it. So making sure that clients are aware of the proper channels for contacting you, for scheduling appointments, and understanding the timeline of services too can really help to manage their expectations. Switchboard offers an excellent client rights and responsibilities guides and template, which we've included in the resources section of this document, which we can, or of this PowerPoint, which we can make available to you all at any point if you would like it after this presentation. Okay, so now we're gonna take a second again to drop something in the chat. So before we dive into discussing boundaries, I would like you all to take a second and think, what's one word that comes to mind when you think about boundaries in behavioral health? Safety, yes. Respect, relationship, yes. Healthy relationships, yeah. Resolution, longevity of care, self-care, yes. All right, wonderful. Thank you all for participating in that. Great. So now we're going to dive into actually discussing boundaries. So one of the key strategies for ensuring safety, one of the words that popped up in the chat, is establishing healthy boundaries. So boundaries can be defined as limits that create a safe connection with clients, enabling them to receive necessary services without risk of harm, right? So boundaries are really essential in protecting both clients and us as providers by ensuring safety, professionalism, mutual respect within the relationship. Boundaries also helps to reduce power imbalances and helps us to uphold ethical standards within our professions by promoting clarity, respect, another word that popped up, and fairness. So it's important to keep in mind that boundaries are shaped by cultural norms and beliefs. So don't assume that clients are aware of your organizational or professional boundaries. This is especially true when you're a part of the same community or share the same cultural background as the clients that you serve. That familiarity can sometimes blur the professional lines, and some clients may expect preferential treatment because of this shared background. When it comes to personal boundaries, it's important to have a good stress management plan in place. This includes revisiting safety plans when you anticipate meeting with a distressed client. It also involves identifying your stress triggers early and addressing them proactively. Another key strategy entails implementing emotional boundaries. It's easy to take a client's words or actions personally during a crisis, but it's so important that you do not internalize these situations. Also, debriefing with peers or a supervisor after a crisis is vital to maintaining your personal boundaries. It can help to ensure that you leave work at work and can disconnect at the end of the day, allowing you to recharge and rest, which is important to prevent burnout. Now, in moments of crisis, staff may find themselves feeling pressured or experiencing a sense of being out of control, which can lead to inappropriate responses like doing something you normally wouldn't do, or making promises to a client that you can't keep in an effort to de-escalate the situation. The U.S. Refugee Resettlement and Security Focal Point suggests proactive strategies for setting boundaries. The first includes clearly explaining your role and the scope of your work to clients. It helps to be explicit about what you can or cannot do, let them know what your working days are, and let them know how they can contact you or someone else in your office if you're not available. Another point is making sure to emphasize clients' rights to confidential services. Be sure to explain what confidentiality means, especially during crises involving self-harm or harm to others. It's equally important to outline your organization's protocol for handling clients in distress. The next point notes to clearly define the boundaries of your relationship with the client, which again is important if you share the same community or cultural background. And lastly, ensure your clients understand which tasks fall under your responsibility versus theirs. It's important to really set clear and explicit expectations. For example, letting them know, I'll refer you to this service by making a call and setting up an appointment, but it's up to you to follow up, etc. And so overall, when it comes to ensuring the safety of your clients and yourselves, your organization should foster a culture of care and compliance. So this slide pretty much recaps some of the strategies that we've already reviewed that are helpful to implement at both an organizational level and a personal level, including the importance of developing well-defined crisis response protocols, implementing clear safety protocols for your staff, establishing a reliable post-crisis review plan that includes debriefing with everyone who's involved, and also making sure to provide support for staff in documentation, training, supervision, and self-care. Adopting a trauma-informed approach throughout your organization ensures that staff are trained to recognize potential signs of crisis and that effective response strategies are in place. This approach helps prevent re-traumatizing clients and ensures that staff can respond appropriately to distress. So the information that we have shared throughout this presentation has come from a number of different sources, which we've listed here for reference. So anybody who's interested in receiving this PowerPoint after this, you're welcome to explore some of these references. And on the next slide, we have links to resources that contain more information about what we've shared. If any of you are interested in receiving those, again, please let us know. We can make them available to you, and we encourage you to explore them as they will deepen your knowledge of crisis intervention and safety when working with refugees and migrants. We now have an opportunity to take some time for a brief Q&A session. You are welcome to raise your hand if you would like to ask a question, or you're welcome to drop it in the chat, your question in the chat. Could you please provide additional guidance for crisis scenarios where the person is not angry, but rather extremely sad or devoid of emotion?
The crisis for mental health crisis when they're sad or devoid of emotion. I mean, honestly, we can provide those. We can provide additional guidance for that, but really, it's just about the idea that you're just continually providing them with the support that they need as to why they're feeling so sad. What is it that they are experiencing or that they are not experiencing that is causing them to be at this current state? Now, the most important thing in that situation is to maintain their safety. Understanding a safe environment if need be. Sometimes what we would do is we would put them in the hospital because we can't actively say that they would be safe when they went home, or we would put them into a facility, or if they had a family member that would kind of monitor over them. We would send them home with that person to go home and make sure that the house was safe. They would take all the sharps away, that they would hide all the knives and all the forks and all the devices at home, or put all the pills away, or whatever like that. Anything that would make the house safe. So I've had patients like that actually in the past where they were extremely depressed. It was a refractory depression, and they went home and they would have to have the pills and the knives and all the sharps taken away. Now, there's also been another occurrence where we had to put that person in the hospital. So yeah, there are definitely multiple scenarios for that, and we can definitely provide a guidance for that if you guys would like to have more information about those. Just put it in CTA request, and we'll provide a guidance for those situations. Much appreciated.
Another point to make is, so aside from ensuring immediate safety, as Dr. Z noted, I think also just your presence. A lot of times when individuals are sad or devoid of emotion, they may not want to speak or share exactly what's going on in the moment. But if you're present and again, offering non-judgmental support, that can assist with a client in crisis and allow them to just gently explore their feelings in a manner that feels comfortable for them. And a lot of times when you think of refugees and migrants, they may not have the words to express in terms of depression and anxiety. I'm feeling anxious, I'm feeling depressed, because in some cultures, those words don't exist. It may be expressed in other manners, somatic, or using other terms. And so just allowing I think it takes a lot of patience sometimes too with clients who are devoid of emotion. But your presence and just reassurance in that manner, I think, can also make a difference in moments of crisis. And I'll let Luz speak as well.
Thank you. I was going to add to that, based on my previous experience, that sometimes silence can speak volumes. So just being there and letting them know that, you're here, support them whenever they're ready to talk or to vent, that you'll be there. And I've had situations where I will come all the way down to where the client, if they're on the floor or they're sitting down, and that has worked tremendously. And sometimes I allow it a couple of minutes and then they'll start saying something, and, I can walk them to an area where it's more of a private environment for them. And that also helps. So, yes, I think just, your presence and just being there, knowing that you're there to be able to hear them and be able to help them out when they're ready to do so.
Thank you, Liz. We also have another question in the Q&A section that says, can organizations get coaching on techniques for clinicians or workers who may encounter clients in crisis? And yes, you most definitely can. On the next slide, we actually highlight how you can submit a request to receive additional coaching. And so, as noted previously in the presentation, we will make these resources available. However, when it says CTA request, when we say CTA request, we're referring to consultation and technical assistance. And we will drop a link in the chat that will take you right to the form that on our website, where you can submit a request for consultation or technical assistance in the form of coaching. So if you would like something similar to this presentation that we've shared today before, like your team, and you would like for us to dive a little bit deeper into some de-escalation techniques, and discuss assessment tools, strategies, all of that, you're welcome to just submit a request via the link that's in the chat. And we will respond, our team will respond within 1 to 3 business days, and we'll coordinate a time that works well for your team for us to be able to connect in that capacity. We also have, aside from consultation and technical assistance, we also offer so many other helpful tools and educational content on our website. We have learning communities that we also host, and we'd like to share that our next learning community, which is the 4th cohort, is titled Building Resilience, and it's also crisis prevention and recovery for refugees and migrants amidst changing environments. So this will be starting next month. If you're interested in participating in this learning community, we encourage you to also note in the chat that you're interested. We'll jot down your email and we'll send you information when the registration starts for that learning community. So it'll be 2 sessions for this learning community. The first session will be focused on prevention, and the second will be focused on de-escalation. So please let us know if you'd be interested. And then also, we encourage you all to take a few minutes to scan the QR code that will show up in the next slide. And that will take you to a survey for you to provide some feedback that some feedback on this specific presentation that we've done today. And this slide right here, this actually highlights just how easy it is for you to submit a consultation technical assistance request on our website. If you just go to our website, which is rmtach.org, you just click on the top button that shows up, the top little blue button that says request consultation and technical assistance. If you click that, it takes you to the form, and then just jot down how we can assist, put as much information as possible, and we will get back to you and provide the coaching and additional support that you may need. So this next slide will now show the QR code, and the link has also been dropped in the chat. So if you could please take a second to complete this survey, we would really appreciate to hear more from you in terms of how you thought this webinar went. And please let us know if there are any additional topics you would like to receive some coaching or training on. Your feedback is really valuable, and of course it helps us continue to do the work that we're currently doing. So I don't see any additional questions in the Q&A. I don't see any in the chat as well. So we would just like to take a second to thank you all so much for your participation and your attention throughout this presentation. If your organization would like to reach out to us for technical assistance or consultation, you're welcome to do so with the link that was dropped in the chat earlier, or you're welcome to email us at rmtachelp@southwestkey.org. Please visit our website to see and learn more about the educational resources that we have, like our learning modules, our learning communities, and we also have an extensive resource directory for you all to explore and utilize in the work that you do. So thank you all so much. We look forward to seeing you at our next webinar, which will be taking place in April. We will be sure to email you all to let you know when the registration for that occurs. Thank you all. Take care.